So good day to everyone joining us, and welcome to our first webinar of 2023. Today's webinar will cover two topics, World Cancer Day and self-advocacy. So to start, I'll talk a little bit about World Cancer Day. And so World Cancer Day is on February 4th and falls on a nice Saturday this year. And it is a leading international awareness day that looks to not only raise awareness, but also improve education and drive action. It was created in 2000 and since has grown into a positive movement for everyone, everywhere to unite under one voice. This year continues the theme of Close the Care Gap. While we live in a time of awe-inspiring advancements in cancer prevention, diagnosis, and treatment, many who seek cancer hit barriers at every turn. Income, education, geographical location, and discrimination based on ethnicity, gender, sexual orientation, age, disability, and lifestyle are just a few of the factors that can negatively affect care. Many of these factors are what are called the determinants of health. They are the range of personal, social, economic, and environmental factors that determine individual and population health. The main determinants of health include income and social status, employment and working conditions, education and literacy, childhood experiences, physical environments, social supports and coping skills, healthy behaviors, access to health services, biology and genetic endowment, gender, culture, race, and racism. So this year's theme is all about acknowledging progress in its many forms that enable more people to seek and receive the care they need and deserve. It is about providing the momentum to fuel our fight for fairness. Sometimes we need to be our own champions to fight for that fairness and equity, and that is where today's second topic of self-advocacy ties in. In the last couple of years of COVID-19, it has been more important than ever to be aware of how to navigate our healthcare system to ensure we receive the care we need, from bumps and bruises to cancer treatments. Today, we are privileged to be joined by Angus Pratt, who has had firsthand experience navigating the healthcare system and self-advocating for his own care throughout the pandemic. Thank you, Angus, for joining us.
Oh, you're welcome, I think.
And so to start, would you like to share a little bit about your journey?
That's probably a good place to start. It'll give you some background as to where I'm coming from. In 2018, I had a break in some very heavy work schedule, and I went to see my GP for some lumps that I had in my breast, and I was pretty sure I knew what they were. My brother had been diagnosed 10 years earlier with breast cancer. My mother died of breast cancer, so I was pretty familiar with it. And so it didn't surprise me when he gave me an immediate referral to the Jimmy Pattison breast clinic here in Surrey, British Columbia. I went and had the normal workup and went in and was handed a diagnosis of IDC, intraductal carcinoma. So I had breast cancer. Unusual for males. Only 1% of breast cancer cases in Canada are men. And so that already put me into a pretty unique category. An amazing experience with the workup. The next day, I went in, had a CT scan, had a bone scan, and at the end of the day, there was a large tumor found in my lung. Initially, the suspicion was that it would be metastasis from the breast cancer. And so they lined up, what do you call that when they take a chunk of your flesh? Oh, a biopsy, that's right. So they took a biopsy, and that biopsy proved to be a new primary cancer, a lung cancer, adenocarcinoma. And that really changed the trajectory of my treatment. Instead of just having mastectomies, I was now facing something much more serious. It was initially diagnosed at stage 3B. With a PET scan, it moved to stage 3C. And I was scheduled for aggressive curative chemoradiation. And That happened over a period of 6 weeks. I was then started on what at the time was a brand new immunotherapy called durvalumab, or as AstraZeneca likes to call it, Imfinzi. And that put me on a path for my mastectomies finally. And I had those. And then I had an experience on the caregiver side of cancer. My wife at the time was, well, how do I describe my late wife? She was diagnosed at the beginning of October with pancreatic cancer, and 6 weeks later, she died of pancreatic cancer. I call that my crash course in palliative care. And indeed, it has informed most of my cancer journey. 9 months later, I saw treatment failure in the immunotherapy that I was receiving. There was progression of the tumors, and I was switched to an EGFR TKI, which I am still on 4 years later. So I am coming up in May. It'll be 5 years, and I will have met that magical 5-year survivor. I will be considered cured. No, I won't. And that kind of puts me into this funny limbo that we can talk about, where I continue to interact with the healthcare system. It means that I am an active patient, but at the same time, active is a good way of describing it. When we finish here, I will go and do an hour's hard workout with the wellness lab from Calgary, and I run 5K 3 times a week. So I am indeed active, and that's just the grace of modern medicine. The drug that I'm on is very effective and is keeping my cancer at bay, but at best I'm stable. Is that a quick enough overview or too much detail? There you go, Lindsay. That's the journey so far.
Well, thank you. That's a great overview and gives us some insight into what you've been through. And I appreciate your openness in sharing that. So to start our little Q&A, I have some questions about your navigation of the healthcare system and the self-advocacy that you've had to do. So my first question for you is, how has COVID changed your relationship with your care team?
So that's an interesting question, and I appreciate having the questions ahead of time, because my initial answer would be it really didn't change it all that much, but it has. It changed it in 2 very significant ways. One is that a whole lot of stuff moved from in-person to phone calls and virtual Zoom meetings. So with my GP, I have seen him once in the last 3 years. With my oncologist, we now meet. I'm beyond the 3-month regular schedule for scans. I'm on a 4-month schedule. And so in between every 2 months, I have a phone call with them. And so that's one set of changes, is sort of with the more formal healthcare system. But I think the second huge change was in the support network. Everything moved online. I had just begun attending an advanced cancer support group in my local cancer center. And with some encouragement from a few of us, that moved online. It was the first place in British Columbia to offer, or the first cancer center in British Columbia to offer virtual care, or virtual care in a support group setting with a social worker. And that group has slowly grown now to where there are patients in that group from across British Columbia. It's not just specifically in our cancer center. And it has also grown from one. I was the sole attendee for the first few meetings. I got one-on-one time with the social worker, but it has now grown to a regular attendance of about 20 to 25 patients, and we meet instead of meeting every 2 weeks as we did initially. Now we meet every week. So that whole support thing is one thing that really changed in my mind. But the other, and then our direct relationships with our physicians. Initially, there was some skepticism for me. In other words, my doctor isn't taking my blood pressure. I'm just telling him what I'm getting at home, and that caused a little bit of trepidation, a little bit of fear, but at this point, I'm quite comfortable with that, and it certainly saves me a lot of time. I don't have to take the 20 minutes to cycle down to my cancer center. I can just have a quick phone call and 10 or 15 minutes resolve all of my questions. So I think those are the two big things that have changed for me. I would also comment, though, that I spend a lot of time supporting other cancer patients. And one of the things that really scares me is the challenge that we're facing now in the system with diagnosis and treatment plans for new patients. Those have always been kind of intensive experiences, and those are very definitely changed. We have a shortage of doctors, which puts a lot of pressure on people. And people are reluctant to go into medical situations, medical doctors, healthcare facilities, and it's making diagnosis difficult. And we're starting to see that bulge of missed or late diagnoses come into the system, and it's putting a lot of strain on resources from what I can see.
Okay. And so you talked a little bit about it already, but my next question is, what did you have to do, if anything, to ensure that you were still able to access care, treatment, and your support? So you said that you had your support go online and your access to care was virtual, but your treatment continued, I'm assuming.
Yes. Yes, it did. And so there are a couple of things. I've had a couple of other medical things impact, and getting a referral to specialists has been one of the challenges for me. And that really ties to our self-advocacy. I have had, since the beginning of my journey with cancer, a challenge with a cough, just a nagging, ongoing cough. At one point, we traced it down to a blood pressure medication that I was on, and that made a significant difference. But it took a fair bit of self-advocacy, asking questions and trying to get to the bottom of it with my GP and my oncologist in order to get a referral to a specialist, an ENT, ear, nose, throat specialist. And I think those are things that in a previous time might have happened a little more easily. That referral process. And so I think that's one of the things that has changed. And it was just that continual asking questions and saying, well, this isn't working or that isn't working, and changing things and continuing to ask those questions, which is self-advocacy in my mind. It's asking for help with the things that are bothering us.
Okay, so you really found that you're putting yourself forward and putting that self-advocacy into play is what really continued that access to care, treatment, and support.
Absolutely. I think I deal with another factor here, and it's hard for me sometimes to sort out what is due to the fact that I have lung cancer and what was due to COVID. And so not to get too personal, but I had a hernia, and my GP really was very dismissive of it. And it was, and I got the distinct feeling that from him that it was, you're a lung cancer patient, you're not going to last very long. And so it's really don't bother with the surgery. It may or may not work. And it was my oncologist that had to step up and say, oh, and literally 3 weeks later, I was done. Not only had I had an interview in order to make sure that I could have the surgery. I mean, I'm a lung cancer patient, so anesthesiologists want to know what they're putting under. So that interview and conversation, and then scheduled the surgery, and bing, bang, boom, it all happened. And I was a little concerned. We were in the middle of a wave at the time of COVID, and I thought that everything would be delayed, and it wasn't, much to my surprise. It was, and I don't know how much of that was just the weight of an oncologist saying, hey, this guy's in a good place, let's get him done, and adding some urgency to it. But it was it was definitely an interesting challenge in sort of, hey, you know, this thing it's more than an annoyance. It's really affecting my ability to exercise and do a lot of the things that I would like to be able to do. It's really hard to run with a truss, if you don't mind me being blunt about it. And I love to run, and it was affecting my ability to run. So I was pleased that somebody sort of saw that this was a quality of life issue for me in many ways, but the health system stepped up and took care of it for me.
That's really good. And so were there other situations where you were able to work around, per se, any restrictions to ensure that you could continue access to care?
I have to tell the story at this point. One of the things that happens when you go into a healthcare facility, at least here in British Columbia, is that there is a check-in station, and they make sure that you're wearing a fresh mask or a decent mask. And they ask you a series of questions, and relatively early in the process, before people were really comfortable with sort of all of the questions and so on, I was being quizzed by the person staffing that check-in point, and came to that question that you get asked. So do you have a cough? And I looked at her and I said, yes, I do, but it's nothing that I can't explain with lung cancer. And the poor doctor behind me just about was just howling with laughter. I mean, it was really quite funny, and I intended it to be funny, but it was the reality that, you know, I had this cough. I've had it for a long time. It's very much a function of the treatments that I've had, of the fact that I do have tumors in my lungs. And so you get that kind of, you know, even though you're wearing a mask in the grocery store and you cough and everybody looks at you, it's that kind of a feeling. But you know, the healthcare system has now, I think, grown to the point where they're really focusing on, have you been diagnosed? Is it a recent cough that's developed? And those sorts of questions that have become a little more fine-tuned to the actual situation. And I think that there's a growing awareness of how important, or diagnosing, or not diagnosing that, because that's not what they do, but a growing awareness of sort of what they're looking for in terms of keeping COVID out of a healthcare facility, or keeping it at least contained. So those are the kinds of things that I've had to learn to, yeah, I need to be honest about the fact that I have a cough, but I need to be prepared to explain what it is that's going on with me particularly. Then again, I guess that comes back to self-advocacy, not being afraid to speak for myself.
Right. And so did you feel in those situations that your care team helped you at all with that, or did you have to navigate it on your own?
Well, that particular situation, I had to navigate on my own. I had to get to my healthcare team. But in that regard, I would go back to the comments that I made at the beginning about the support meetings and the advanced cancer support groups, and just how, I mean, here was a young social worker who had never really used Zoom before, and she just went to the IT department and said, hey, you know, one of my patients is asking me to do this online. I know we have a Zoom account. What do I need to do? Give me the headphones, give me the camera, let me get started. And I was really, I mean, it was pretty, I thought, magnificently innovative of her to do that. And really, it kicked off something within BC Cancer that hadn't previously been done. Now they are offering virtual support groups, what they refer to as site-specific, which doesn't mean a physical location as you and I might think, but they're offering to the various tumor sites. So throat and neck cancer group, a brain cancer group. They just started a lung cancer group here in BC, and all of those are virtual groups. And so I think that innovative piece that one social worker took advantage of, maybe it would have happened in other ways too, but is now spread, and patients are connecting with patients, which in my mind is one of the most important pieces of treatment for cancer patients. The support that they get from their fellow participants in their disease is just something that can't be replicated any other way. The knowledge, the wisdom, the encouragement, the hope that's generated in those situations.
Right. I'm sure it's very impactful. And what would you say was the most significant impact that COVID and public health restrictions had on your care and on your life?
I'm going to take Kathy's question from the Catherine's question from the chat, if that's okay. So yes and no. Our support group had an interesting history. We had a situation where we had a very strong support group in person, and we had a transition of social workers, and the advanced cancer support group went away for about 2 months, and several patients got together and went to their local MLA and said, hey, they're telling us that they can't recruit a social worker and that they can't run this group, and it's critical for advanced cancer patients. And so the MLA made a couple of phone calls, and guess what? The next week, that group restarted. They found a social worker, and it's restarted. And that was the point. I was involved with that group in person at that time. And so that new social worker had never run a support group before and was very much learning how to do it. And it was about, I think, 2 months after that we had the lockdown, and those support groups, those in-person support groups, were all canceled. And it was in a very brief email exchange with her about that cancellation. And I just asked her when she was going to start offering it to us virtually on Zoom. And she emailed me back and said, let me look into it. And so that was exactly how it got started. And that was because I knew that it was important to us, and I knew that people had the technology, the technological ability to do it. At least 2 or 3 of the members did. Sadly, they have all passed away now. That's one of the things that happens in an advanced cancer support group is the patients that I started that with are all gone. But it did start with one social worker and her sort of moving through the system. Now back to your question, Lindsay, which I've promptly forgotten.
That's all right. So what was the most significant impact that COVID and public health restrictions had on your care and on your life?
2 or 3 big impacts, huge impacts. I was working initially, or I was, so on my work life was probably the biggest one. I had just gone through my treatment. I was just starting to feel like there was some hope in my life again. And I had gone back to work. I was working as a first aid attendant on high hazard job sites, and I was working part-time for a couple of different companies. And initially with COVID, my idea was, I'm a healthy young man. I will go out, get this disease, and then I will go and I will be able to help the healthcare system manage through COVID. Yeah, my oncologist got a hold of me by the scruff of my neck and gave me a good shake and read me the riot act. We had a long conversation about do not resuscitate orders and respirators and the likelihood of that's where I would end up if I got COVID. And then very promptly after that, I had 2 friends, close friends, people that I had worked with in a church setting, and one of them was a Sea Scout leader with me who died of COVID very early in the pandemic, and that really brought home to me that this was a deadly disease and that it could kill. And it was funny because it was almost a year before I talked to anybody else who had had somebody who was that close to them die. It was a slow roll for a lot of people to get that kind of exposure and experience, and I had it early on, and that just took away my livelihood. Essentially, it was so in that sense it had a huge impact on my working life. The other factor was that my caregiver, the person who accompanies me to my appointments, lives 4 hours away up in Vernon. And she was unable to travel, unable to participate in my appointments with me. And that continues to this day. Now, fortunately, I have not had to have bad news delivered or any of those sorts of things happen without her by my side. But it was really, it's one of those things that I realized that when things go south for me, it's a relationship that I'm going to have to renegotiate and work my way through. So those are the two big impacts, I think, for me of COVID. And I've found other ways. I've had a number of surgical procedures, and I've just used local friends, or in one instance, my landlady, to deliver me to surgery or pick me up. So those are the ways that I've been able to manage, but those are also pretty heavy impacts.
Yeah, so you were just mentioning at the end there that you've found some ways to deal with it. Were there other alternative methods that you've used to handle those restrictions being placed?
Absolutely. So one of the things that right from the get-go, my wife that I mentioned earlier, prior to her dying, was American, and for a variety of reasons couldn't cross the border into Canada to be with me at my appointments. And that's how I ended up with my stepmother from Vernon as my caregiver. But we recorded all of my appointments. I simply would ask for whoever I was meeting with, whichever doctor I was meeting with, I would explain the situation and just say, I'd like to be able to record our interactions. And in all the time I did that, I only had one doctor refuse. And I understand why. She wasn't the world's greatest communicator, and I thoroughly enjoy her and get along well with her, but that's not the case for every patient. And so I understand that. But what she did for me was, at the end of our conversation, she took my phone, my recording device, and she recorded a summary for my partner. And that was, absolutely invaluable. So that was a common practice for me, and I've been able to continue on with that. I have to be really quick on my trigger finger because my doctor likes to introduce himself and start the conversation from outside the exam room. I don't know why he does that, and we laugh about it every time. And I just say, okay, we're going to start this conversation over again now that I've turned on the tape recorder. But it's there are, on one occasion, I have done a phone call where I have looped my caregiver in with a phone call. But again, just asked permission, and the doctor was fine with that. He understood that what we were talking about was a complicated situation, and that I wanted somebody else to listen and hear what was going on.
Well, I'm glad you found some ways to be able to alter the situation to be able to make you feel like you were still maintaining a level that was acceptable to you. That's really great.
Let me add one more piece to that. I would say that one of the things that I've seen happen in the support groups is the social worker take an active interest in various difficult situations that arise. There are, over time, I have seen, people's, how to say that, personalities don't always get along well. And I have seen the social workers now step in a number of times to advocate with the patient for changes in the way that something was being handled or being done. And I think that that's something that, it's pretty amazing when you can have a virtual support group and the social worker can detect that there's concern here and can then step up and say, okay, I will phone you afterwards and get the information, and then I will speak directly to the people involved and we will sort it out together. And I think that that's, I don't know if my social worker is unusual, and I claim her as mine. Nobody else can have her, but I think that that's a support that has been really crucial for a lot of people in navigating their way through some of the challenges that COVID has presented. Little things like, well, my doctor only wants to see me virtually, and I really think he needs to palpate this lump. And so those sorts of, oh, well, let me see if we can get that appointment changed or set up properly. And those sorts of things where I wouldn't have anticipated that was how it was going to work, but it has, and it works very well.
That's good. That's good to hear. So in regards to that, what are your most important suggestions when it comes to self-advocacy?
I'm going to start from a lot of people don't feel comfortable speaking up for themselves. And I get that. When I started, my family kind of wrapped their arms around me and said, Angus, remember, they're the doctor and you're the patient, because they knew that I would have there would be a temptation for me to question. And I know at one point I was under the care of the breast surgeon, the radiologist, and my medical oncologist. And I had two of them in the room and the third one aware of the fact that I was having the meeting. And I just said, who's in charge? If we have a problem, if there is a disagreement about how this treatment is going to go forward, who do I listen to? And I thought that my oncologist's wisdom and his response was very, very reassuring. And he said, and it was simply that we have never had a major disagreement, and we've seen hundreds of patients together. And so that gave me a lot of confidence in working with them. But not every patient is comfortable speaking up and asking those hard questions, like who's in charge. And I think that is something that the patient needs to be aware of. And so be aware of who you are as a patient, and find somebody, a caregiver, that can be that advocate for you, somebody who potentially understands the language, or if they don't understand the language, they're prepared to ask the questions until everybody is comfortable. It needs to be somebody who is sensitive to you and to your desires and to your feelings. I started off with a different caregiver, and he shall remain nameless because he's still a good friend. But after I received the news that there was a big lump in my chest that they hadn't anticipated, he and I went out for breakfast together, and all he wanted to do was talk about his diabetes and his headaches. I was facing potentially lung cancer and a diagnosis, and he wanted, and so there isn't a fit. You have to find that patient that can speak up, or that person that can speak up for you or with you. I always advocate having a second person available, a caregiver, to hear the things. When you get bad news, your system shuts down to some extent, and you can't hear it. And so that's the first thing that I would say. The second thing I would say is be prepared. There is a lot of literature out there around cancer. And the Canadian Cancer Society has a whole range of materials. The particular cancer that you have also has, in my case, Lung Cancer Canada has a huge patient handbook. Get a hold of those and have a look and try and figure it out. Most of those materials will have a list of questions in them. And to me, that's, I printed those off, and I had them for my first meetings, and was able to ask, I think relatively intelligent questions, because I had a sense of that. Don't just go in and listen, but go in and have your own questions, things that you want to understand about your disease, like what are the options for my treatment, and do I really have to have this chemo? What are the risks associated with this chemo? So I think those are really important pieces of self-advocacy, is to be prepared, and don't just assume that your doctor will tell you. I did end up in an operating suite at one point for a fine wire biopsy, and I had missed a phone call. I didn't get the phone call. The system messed up. And I ended up there, and the gal said, "So don't see anybody here with you. Who's your driver? Who's going to take you home?" And I said, "What do you mean, driver? This is like, you're not going to knock me out. You're just going to numb a spot on my back and shove a wire into me." And the surgeon kind of looks at me and he says, "Yeah, I'm going to shove a needle into a balloon, your lung, and the potential for that to collapse is pretty high. You really shouldn't be driving yourself home after that procedure." And you know, I hadn't received the phone call, and in my mind, it was a relatively simple, straightforward procedure. And I didn't ask enough questions. And I ended up in a situation where I ended up having to sit and wait through a set of 2 more x-rays than normally would be done to make sure that my lung wasn't going to collapse when I went out and drove myself home. They let me do it, which was probably against all their healthcare instincts, but those are the things that you know, if I had thought about it at all, I would have realized what the procedure was going to entail and why I should have a little bit more help than what I had in terms of getting myself there and home. I haven't made that mistake again.
Well, that's great advice. And I'm glad you shared that with us. And thank you. And so my final question around the self-advocacy is, how has COVID impacted your health and your treatments and your mental health?
So let me start from the tail end of that question with mental health. I think one of the things that it has affected is my social interaction. There is something very different about interacting with people on Zoom. I track my computer time for a variety of reasons, and I spend about 20 hours a week on Zoom. That's out of about 70 hours that I spend interacting with electronic devices. And of those 20 hours, I can't tell you how many people I have now met that I met initially on Zoom, and they are completely different than I had envisioned them. I literally can't recognize them. That's how different the flat, 2-dimensional picture is from the 3-dimensional person. And I think that really has had an impact on mental health. And so while I praise the support groups and praise the connections that can be made, we need to be aware of the limitations of these things. I think the other one of the positives for me is that I'm not sure that I would have made the national level connections that I have made if I had not had Zoom and we hadn't all been in this kind of lockdown situation, because we were able to reach out to each other in ways that we probably wouldn't have if we had been involved with a local support group. And so particularly in the lung cancer field, I think that there's been a huge groundswell of people connecting and doing and getting more actively involved in lung cancer advocacy. That's a side effect of COVID. In terms of my treatments, about the closest I've come to having to have my treatment altered because of COVID or anything like that, I'm on a daily pill, so really it doesn't make much difference. I came home from a conference in Montreal, and a few days later had COVID, much to my chagrin. It lasted a whole 24 hours. Very, very mild case. I was so fortunate. And I was offered Paxlovid, and in hindsight, and I was already feeling better by the time I got it sorted out that I was eligible, and that both my oncologist and my GP were both willing to prescribe it for me. But I did have the question for my oncologist, is there any interaction with the drug that I'm on? And that was a question that wasn't easily answered. So he looked it up, and sure enough, there was an interaction with the drug that I'm on. And since one of the side effects of my drug is diarrhea, and one of the side effects of Paxlovid is diarrhea, here I am facing more diarrhea. And because I was already feeling better, I chose not to do it. And I still had 4 days in sort of that 5-day window. In hindsight, I have now done enough reading and enough that I think if I get it again, which is a distinct possibility, people don't just get this once and they're cured. You can have multiple infections. I will definitely avail myself of Paxlovid. I think that was a mistake that I made just because I'm reluctant to take pills. But I think that in future I would take it. And many of my fellow lung cancer patients have taken it and found it to be quite a relief. So that's probably the biggest effect that I've seen on connected to my treatment. In terms of my health, I will make the comment that cough that I mentioned earlier, when I did get COVID, that was early December, that cough became worse and it lasted until almost the new year. So a month after, yes, all the achy fever symptoms of COVID were gone, but the cough remained. I'm surprised I haven't broken down coughing a little bit during this conversation, but I haven't. And what I hadn't realized was that there was a congruent or concomitant of fatigue. And it wasn't until about 2 weeks ago that I realized that, all of a sudden I was working all day. I was able to miss naps and some of those sorts of things. So there were some effects of that COVID infection that really I wasn't as aware of as I might have been, between the cough and the fatigue that hung on for a while. And I won't say that it was brain fog, but it was definitely a general malaise, and maybe some of it was Christmas holidays and whatever happens in January, but in terms of depression, but I think that to some extent I would attribute those symptoms to COVID. So in that sense, it affected my health. I didn't run as regularly as I do through that period, and that may have also had some effects.
Okay. So to tie in World Cancer Day, I have a couple questions as well. So some of those determinants of health, and so they tend to become barriers for some people in their care. Have you found that you've ever faced any of those?
A couple of them. Income would be an interesting one. I am highly reliant on our social assistance network or system here in Canada. In my initial diagnosis, I was given the option of waiting for a PET scan, even though they would put in an urgent on it, or I could go to a private PET scanner here in British Columbia and pay $3,000 and go and get my own PET scan. And that would accelerate the process considerably. As it turned out, it accelerated, or I waited about 2 weeks for my PET scan. And that's a pretty common experience. PET scanners are a crucial diagnostic tool in a lot of cancers, and we don't have very many of them in Canada. For whatever reason. And so it is an area where private clinics have moved in and are providing a service. And it's, without making any bones about it, it's an income-based service. If you can afford it, you can skip the system and get it done more quickly. And that bothers me to some extent. But so there's definitely some disparities there. Another disparity, when I was switched to the drug that I'm on now, afatinib, I was offered osimertinib, which had been approved by Health Canada at the time, but wasn't funded. And I had to wait for that process to wind its way through the healthcare system. And it is so slow. It was painful. It was incredibly painful. I learned, that's really where I learned about how drugs get approved and funded in Canada. And it's shameful. let's just leave it at that. So I experienced it there as well. If I could have paid for the drug out of my own pocket, or if I'd had insurance that could pay for it, I would have had it. It theoretically is a better drug. I can't say that now that I've been on the drug that I'm on for 4 years. I'm doing fine, so it isn't. I spent a lot of time working in northern Saskatchewan, and I saw a lot of discrimination and a lot of I am, I guess, super sensitive to race-based challenges in our system. I think I heard a discussion yesterday where they were talking about the fact that we have 13 different healthcare systems in Canada. And I think that what I like to refer to as postal code healthcare, the fact that we have cancer refugees here in British Columbia because they can't get the treatments that they need in other provinces is absolutely shameful. And I think that kind of discrimination is really something that needs to be brought to our politicians. They need to get their act together and really address the challenges that healthcare is posing to our system. The idea that we have these provincial inequities is just really a challenge. One of the things that I like and see a lot of here in British Columbia is we're starting to see a lot of ethnically based support groups, particularly for the Asian communities and the South Asian and Asian communities. And I think that's starting to address a lot of inequities and challenges that our healthcare system was facing here in British Columbia. I can't speak specifically to that. There's one final inequity that doesn't often make the list, but I will point it out. If you were to look at the names of the people who are participating in this webinar, you will, and make some assumptions about gender, you will realize that there is a disproportionate number of women that are involved in patient advocacy. And I don't know why that is. I don't know how it happens, but I can point to it in so many groups, in so many support activities, so much patient advocacy that I do, that men have been reluctant to get involved in this movement and speak to the challenges of the healthcare system. And I think that is something that we really need to examine what the roots are. And we need to talk about how do we get more men willing to speak up for themselves from a self-advocacy perspective, but how do we get them to speak up for the changes that need to happen in the system too?
Okay. And to tie into that, how would you kind of touched on it a little bit again, but how would you personally take action to bring some awareness to that?
I just did, didn't I?
You did, exactly. Like I said, you touched on it.
It's called speaking up.
Yeah.
Speaking up, and not really being shy about it either. So when I was refused the drug that I really wanted to be on, and part of what I did was meet with my MP for my area and with MLAs, and I've kept up that. So I think that there's a role for politicians to play here. And the healthcare system has been very reluctant to speak up for itself for a variety of reasons. And so I think that when patients have the ability to do that, we need to take those opportunities and advocate within the governance of our system here, and that's to in Spanish we have a saying, el bebé que no mama no, or que no llora no mama, the baby that doesn't cry doesn't suckle, and I think that's part of we need to speak up, and that's a big part of what this is. But it's also, I think, necessary to be aware of where the shortcomings are, and to identify our own needs, and to recognize when we're not being treated well, and to speak up. And I think that's part of what happens, for example, in support groups. we realize that the experience that we're having is not normal, it is not fair, and it gives us the ability then to go and find like-minded people and speak up about those situations in terms of inequity.
All right. Well, I thank you very much for answering all those questions for us, Angus. I think it gives us a unique look at what it looks like for patients who have needed care through the pandemic and beyond that. And so now I would like to take the opportunity to invite anyone who has any questions or comments that they would like to put in the chat. We'll address as many of them as we can with the time that we have left. And so if you'd like to do that, you can do that now.
Maybe while we're waiting for people to put those questions in, one of the things that's been a huge help to me in my advocacy is a funny podcast that I ran across early in my journey called The Waiting Room Revolution. It's put together by two palliative care researchers. One is a doctor, the other one is a PhD from the Hamilton area, Sien Zhao and Dr. Sammy Winemaker. And the Waiting Room Revolution talks about what they call their 7 keys. And it's really, they're coming from a palliative care perspective, but I think it could be parlayed into supportive care and it can be parlayed into advocacy. Their 7 keys are simply walk 2 roads. So you plan for or hope for the best and plan for the rest. Their second key is to zoom out, try and keep the big picture in mind. Sometimes we get focused on a particular treatment or a particular challenge that we're facing, and we forget that there is a bigger picture. When I was advocating for my change in medication, I had to realize that. When I was denied, I realized that there was nothing that I was going to be able to do as a single patient to change the situation that I was in. And I simply had to accept that. I had to look at the bigger picture and realize that, there was a substantial saving for the healthcare system in me staying on the medication that I was on. And I had to accept that. I think you have to know your own style. That's a little bit of what I was talking. That's key number 3. That's a little bit of what I was talking about. If you can't speak up for yourself, find somebody who can. Know what it is you're looking for in terms of managing risk and some of those sorts of things. Customize your order. A lot of people, particularly in the cancer treatment realm, I was talking to a patient yesterday who has been dealing with mouth sores and some other issues around his treatment. And his oncologist said, missing your pill for a day won't stop. You've been on this now for a number of years. And it's not like the cancer is going to catch fire and run away if you skip your pill for a day, but it will help you recover. And I think that those are the sorts of options that aren't offered to patients very often. And we need to be aware of the fact that they are options. So know what you're looking for. Expect ripple effects. When you talk, a lot of times, or when you are experiencing cancer, there are ripple effects. I am still surprised at some of the things that happen. I was talking to somebody the other day, and a new acquaintance, and her comment to me was, I know I'm setting myself up for heartbreak by getting to know you in more depth. And I had not anticipated that comment, and those are the kinds of ripple effects that happen. Don't be afraid to connect the dots. Initially, it used to really aggravate me, is key number 6. It used to really irritate me that I had to communicate between my GP and my oncologist. Like, don't they read each other's notes? They don't. You have to help them and connect that for them. And 7, their 7th key is invite yourself. And I guess that goes back to what I said earlier about asking questions. Make sure that you bring yourself to the table. Don't let the radiologist and medical oncologist make the decisions without you present. You are the patient. You are the one that they are treating, and you have the responsibility to speak up about what it is you expect and what you want. And so I think that those are really important keys. And I'm not seeing any more questions in chat. And oh, there we go.
Well, thank you for sharing that with us, Angus. I think that was, again, very insightful and very important to share with us. And thank you for the comments that were put in the chat throughout the webinar.
You see one last question here from Samar.
Okay.
And
let's see that here.
Main priorities that organizations and cancer support groups should advocate for: more information, more financial support, more psychosocial support. Yes, all of those. But I think one of the things that I have come to really appreciate is ultimately, at the end of the day, it is research that's going to change things. I was at a Healthy Matters conference earlier in the fall, and one of the speakers talked about how do we change the minds of politicians, and believe it or not, it's research. It's showing that we can save money, or it's cheaper to do this than it is to do that. The fact that palliative care is more effective than some of the treatments for lung cancer patients was shown in a study in 2011, and yet palliative care isn't offered to most patients until 17 days before they die. That's wrong. It has a powerful effect. The supportive, and part of that is the patient's own perception of palliative care as death squad, but part of it is the system's unwillingness and the system's consideration, but that supportive care can extend and improve quality of life very dramatically. And so I think those are the sorts of things that we need the research to be able to say to the systems, whether it's the political system or the healthcare system, that implementing these changes will make a difference in the quality of a patient's journey with cancer. So I think that when I have to identify a single priority, that would be the one. And it's funny that after 5 years, I'm finally getting in that piece, that picture.
Okay. Well, thank you for fielding that question, Angus. And I think you've gave a lot of insight to everybody today. And I want to thank everybody who joined us today for the webinar. And excuse me, I hope everyone has a wonderful rest of their day. And we will see you on the next webinar.
I just want to thank all the people that have come and listened to what I had to say. That always surprises me, and I'm grateful for your participation. And I hope that you go away with something that changes the way that you live and the way that you experience your journey. Or if you're working with cancer patients, which I suspect a number of you are, that it gives you some insight and perspective into the interior life of what it's like to be a cancer patient. Thank you.